and by 1 year we touched around 500 patients a day.
Wow. What are the key challenges managing hospitals today?
The core manpower in any hospital is medical and nursing.
And what makes you turn into administrator? Hi, welcome to Health Care Maverick channel. Today our topic is everyone wanted to start their own hospital, and most sought after profession is healthcare profession and medical profession. And today's scenario, starting a hospital is very difficult. We're going to find out whether it is worth or not. If it is worth, how we can run successfully. If it is not, we're going to find out. To find out, we have a special speaker today who is coming from the best hospital in Tamil Nadu and best in Coimbatore. And yes, that is PSG Super Specialty Hospital. Dr. J.S. Bhuvaneswaran, who is a 32 years plus experience. He is a director and who is shining star of this hospital and running successfully. Welcome, sir. Welcome to the show. Yes. So I'm very happy to have you today, sir. Sir, this Healthcare Maverick channel, we running for hospital owners and doctors who want to run their hospitals effectively and run their clinic effectively. So today this podcast is mostly focused on the topic which I said, that how to run this hospital effectively. Today's scenario it is worth and what you say like that. So before going into deep, I want to know more about you. Can you share a bit about your journey, sir?
Basically, I am from rural background. I hail from Gobichittipalayam. I studied in a Tamil medium local school, and I came quite well in my academic school as well as my college journey. Through merit, I joined Stanley Medical College, Chennai. I came out as the best of going from there. Then I joined for my MD, Kasturba Medical College, Manipal. I joined the prestigious Sri Chittarai Tirunal Institute of Medical Sciences for my doctorate in cardiology, that is DM cardiology.
That is in
Trivandrum, which is a central government institution. I passed out of my DM at the age of 29, and then I came and started my career. Short stint in GKNM Hospital, after which I shifted to, rather I was asked to start the cardiology department in PSG hospitals as a first specialty doctor in PSG in 1994.
Wow.
Precisely 30 years before.
I just born in 1989. Sir, you are such a mentor to me. I always love you and very happy to have you today. And it's happy to know that you started a cardiology department.
Yes.
Sir, you are a renowned cardiologist. Everyone respects you much. And what makes you turn into administrator?
In fact, I fondly remember when I was as a young cardiologist, when I was called by PSG management, they asked me whether they can try starting a specialty hospital with me. In fact, he said, "Can we try it with you, doctor?" That's precisely the managing trustee asked me. I said, "Yes, sir. If you support me, I will do my best." And that support had led me to almost around 15 years of hectic cardiac practice. And I was doing almost around 10 to 12 hours of active cardiological practice till 2007. In 2007, during one of our conversations, when actually I went to represent an issue of one of my colleagues to the management, I told them that the needs of the super specialty doctors are different from the basic department or first tier doctors, and so we need to have a representation for the super specialty doctors. Then the managing trustee smiled at me and said, "Why can't you be the representative?" No, that is exactly how from core cardiological practice I came to be a part-time administrator. Interestingly, that's the time PSG management with Madras University started MBA Healthcare Administration course.
Okay.
And naturally, I always had sort of a liking or some sort of admiration for this degree MBA. I used to wonder what is being taught in MBA. So I grabbed the opportunity, and in 2009, I joined MBA Healthcare Administration. It was a 2 years course, almost 18 subjects, which I loved doing it well with a full-time project. So from a full-time cardiologist, becoming a medical director at that time with the MBA, naturally pulled me more and more, sort of deviated me more and more from clinical side to the healthcare administration side. But the pinnacle of it was when I took a decision to move abroad, especially having served PSG for almost 20 years. I thought I should have to really explore becoming in international scenario, I took a decision to move to Abu Dhabi as a cardiologist actually, not as administrator. I went to Abu Dhabi as a cardiologist in one of the very well acclaimed hospital by name Ahalia group of hospitals.
Yes.
Interestingly run by Dr. Gopal sir, who is the chairman of the group. He has a very large presence in Palkad here, as
Yes,
you may be aware.
yes.
And Sir said, Doctor, please join our group. And I was, as a cardiologist, I was practicing for 2 months. One fine afternoon, he called me and said, Doctor, we have a brand new international style hospital with an investment of almost 400 million dirhams. We are looking for a medical head to run it. It means you have to get the license to run. Start the operation from day one. Will you be willing? So Dr. Gopal sir called me and said, it's a full-time job, doctor, because it's a large investment, and would you be willing to shift to medical administration? And he very clearly said, that means I'm asking you to reduce your clinical practice from 100% to 20% and healthcare administration for 80%. I was honestly not prepared to answer him immediately, although intuitively I said, why not, sir? Yes. So that is where I became sort of a full-time medical administrator, giving much lesser time to clinical cardiac practice. It was a wonderful experience because we started from sort of licensing was done in one shot, which is again in the history of Abu Dhabi, it has never happened. Always they never clear a large hospital of that size in one licensing clearance, which we achieved. Then we started day one with 2 patients, and by 1 year we touched around 500 patients a day.
Wow.
The second year completion, we had a JCI accreditation with the highest ranking of almost 99.4 marks. By second year, we touched 1,000 patients a day.
Wow.
And we had almost around 100 doctors. Most of them are multinational, with a good number of Indian doctors and good patient profile. All this gave me a confidence as a health administrator, which I started liking more. And in fact, I always felt that cardiology is one of my most passionate subjects. Medical administration also started becoming a very passionate thing to my heart. So that is how the shift happened.
Lovely, lovely, sir. Very happy to know that you have been taken the hospital from the beginning to the per day 2,000 patients a day. That's very great to hear. So, what are the key challenges managing hospitals today?
I would say that a hospital currently has 2 eyes and 1 nose.
Uh-huh.
The eyes are actually, one eye is finance, the other eye is a quality healthcare which you have to provide. The nose is having a proper manpower. So when I say these 3, all the 3 are like a triangle, which are the most key areas of a hospital to be successful. And when I say finance is of 2 types, as you know, that the invested finance and the borrowed finance. And quality healthcare, there is no 2. It is the core important thing for any hospital. Because I always say that a hospital gets patients only because of the quality care. And there are no compromises in that. Now, if these 2 happen, you should have a manpower. When I say manpower, that is of 2 types. The core manpower in any hospital is medical and nursing.
Medical and nursing.
You should have the best ethically practicing, talented, good doctors and a good nursing force. And the second additional is all the supportive departments of a hospital. That means if you have a well-managed finance, a good manpower who can provide a quality healthcare, let me tell you honestly, you will be a winner.
So, in this, which is most challenging one and why?
Actually, the most challenging in this is actually the finance. Now, why I said, because in the beginning of the interview itself, you have very clearly said, in your experience, you have been seeing many people who are venturing in starting a healthcare facility, let it be a clinic or a nursing home or a small hospital, even large institutions. And many of them, in fact, if you really look at it, probably around 1/3 only make it for about 5 years. And out of that, probably another 50% only sustain over 10 years. Now, that is a statistic. So, having said that, most of these things fail because of poor management of finances. Because generally, people, nobody invests from their own finance. They always go for a borrowed finance. When you are going for a borrowed finance, or when you go to the institutions which lend you money, the mismanagement, miscalculations in finance, and the piling up of the loan amount, interest amount, that is where, when the attention to the healthcare starts becoming less, and people will be going more into how do I manage my next month installment, this is where exactly the failures start coming in. So, having said that, so the very first foremost in my mind is proper management of finance. Probably second in the list will be, again, the most important thing is to have manpower. Now, this is very challenging because currently there are two types of manpower, as I told you.
Nursing and...
Now, one of the most difficult things in healthcare scenario is having a proper nursing team. Even I'll come to the doctors even a little later, because nursing becomes one of the largest challenges, primarily because in my MBA, I did my project was on attrition in healthcare. That was in 2010. When I did, the attrition rate in our own nursing fleet in PSG was 17%.
17%.
17. Now, I asked my HR team to do an attrition calculation a few months back. It is now an astounding 38% in nursing. That peak.
This increase.
So, it is not just increase, it's almost 2.5 times more. Now, what do we realize? Now, retaining a quality nursing team is one of the major challenges which all hospitals face. Then next one is coming to the medical care. In medical care, if you see, there are two models. One model is a full-time availability of the doctors to the hospital. The other model is running the show with doctors who visit, spend a part-time of their time, and so this is the two models. Both the models have their plus and minuses. But in PSG, our majority, almost 90% of our doctors are full-timers. Where we are able to get our doctors, I would say that the USP or the unique selling potential of our institution is our medical care.
Yes.
I have excellent doctors who practice quality care, quality ethical care, and they do what is needed, and they give what is needed. So, whereas there are hospital models where you depend more on visiting consultants to run, there actually you may have big names who are coming and going, but they would not listen to you the way what you want. They would practice there, and you may have to adjust your requirements. So in these two models, the medical and the nursing, that is again a very challenging thing for in a healthcare industry next to the finance. So if you have to be successful, you have to be very, very clear, which I said in the beginning itself, as two eyes and one nose.
Sir, I want to zoom it a little deeper into this. Let's say a scenario that a hospital newly started. Yes, the hospital owner would be the medical profession. Let's say he is a cardiologist or neurologist. But in this scenario, now he built a, let's say, 100-bedded hospitals. So yes, he already practiced in a clinic setup or he in an institution setup. He might have some following of his patients. Now he started a new one. In this scenario, he may get the same patient flow into the new hospitals. Because this question I'm asking, since he's a clinic setup now, so it might be he can able to manage all the expenses, okay, fine. But if it is a 100-bedded hospital, he going to hire a new doctors. How he gain a new patients? Because why I'm asking this, you said that you started Ahalia from zero today, 2,000 a day. So how he can pull a patients? What are the ethical ways you can suggest?
Actually speaking, again I want to highlight two models. One is somebody starting a single specialty hospital, successfully running, branching to become a multi-specialty hospital. I can quote immediately example which is available now in Coimbatore is Ganga Hospitals. Ganga Hospital was basically a single specialty hospital, ortho and probably plastic. And now you know they are one of the very well successfully running multi-specialty hospitals. recently, in fact, I met one of my students who was basically passed out of PSG Medical College. I met him in an alumni meet. He is basically a neurosurgeon. His brother is a neurologist. They have started a small hospital to start with in Avinashi. And I was so proud and happy to say that now they are become one of the big multi-specialty hospitals by name CNS hospitals in Avinashi. Now this is one scenario. Whereas in Ahalya hospitals, which you asked me, we started as a multi-specialty hospital. We always were very clear that we should have all the standard branches which should be available in a multi-speciality with the basic departments and the super specialty departments. So that is another scenario where you have starting a hospital with multiple departments. So single specialty becoming multi-specialty, multi-specialty to start with. So these are the two models. Now your question is that how do we run this successfully?